Hello, Dan Lahane again. Today I'm going to talk to you about our products a little bit more. I know that I've already shared a little bit about our cancer policy with you in our corporate overview. Today I'm going to just reiterate a few of the benefits of the cancer plan, but I'd also like to jump into the other products that we do sell. We have 5 main products, really 6 if you include our life insurance, but the lead product is our cancer product. But we also have an intensive care plan, a heart attack and stroke plan, and an accident plan. We have a hospital indemnity plan, and then of course we have our life insurance. I'm going to go over the majority of these products with you today. Again, my purpose isn't to get you to purchase one of these policies from me, but rather just to kind of tell you what we sell and give you a flavor of what we sell. This also is by no means going to be used as your training, your product training, but again, just a taste of what it is that we sell. So again, I've already told you a little bit about the cancer plan, but I'm going to start again here and let you know that our cancer, all of our products are phenomenal, but our cancer is our lead product. You see, the thing about cancer is we just don't know who it's going to affect. The American Cancer Society tells us that cancer is going to affect 3 out of 4 families. So cancer plays no favorites. The cancer has risk factors. A lot of people, when they hear about cancer, they think it's something that's hereditary, but the American Cancer Society tells us that about 75% of all cancers are not hereditary at all. It comes from our environment. Things like you can see at the bottom of this brochure, the air that we breathe, the food that we eat, the water, where we work, where we live. Hereditary is a factor, but also tobacco and diet and weight. So these are the risk factors. But the thing about the good news is that more than 6 out of 10 people that are diagnosed with cancer this year will survive. So that's the good news. The bad news is it's just very, very expensive to survive cancer. In fact, they estimate that it's going to be over $226 billion spent fighting cancer. And the way that those $226 billion are spent is 2 different types of cost. We have the direct costs, which include things like the doctors, the hospitals, the medical charges, the medical expenses. The problem, and that's what our major medical health insurance is designed to cover. But the problem is that the larger expense, the $123 billion, is not covered by our health insurance. And so that's why we exist, because that $123 billion is going to come out of your pocket. It's going to come out of the patient's pocket. So we actually pay money directly to the family to take care of things like not being able to work, lost income and savings, your living expenses, limitations with your insurance. Every insurance company has, all health insurance has a deductible and a co-payment and things that are undercovered or not covered at all. So that can be another big expense. Travel for the best treatment can be an expense, in-home care, and then sometimes even child care. So what we find is that most people end up paying for these expenses by using savings and investments, or having to sell assets, go into retirement funds or college funds, or you name it. Just anywhere that you can get money to help pay for these expenses is where people go. Now, one thing about all of our policies is everything's paid directly to the individual client. So it pays benefits directly to them. If you go down underneath that bullet, it says it pays in addition to anything else that you already have in place. The policy benefits are never reduced. The premiums are never increased, no matter what. It doesn't matter if you get older, if you're making a lot of claims. We've never raised a rate on anybody. And it's guaranteed renewable for life. So the only person that can ever cancel this plan is them, and they can cancel it whenever they want. And there's no cap on the amount of benefits it'll pay. So it just keeps paying and keeps paying until somebody's all better. So this is what it covers, and I did cover this with you in the corporate overview, so I won't go over all the little details, but you might remember the very first thing that happens as soon as someone's diagnosed is we have a first occurrence benefit. And then it goes into a hospital. Once treatment begins and someone has to stay in the hospital, we pay money for every day that they're in the hospital with no limit. We have an ambulance benefit. We have hospital services. There's a surgery and anesthesia benefit, second opinion, reconstructive breast surgery, leukemia and bone marrow transplant. If you're a donor, so if you are a match for somebody and you donate your bone marrow or your stem cells, then there's a benefit that's paid to you. Even if the patient doesn't have one of our policies, you do, so we're paying you for donating your bone marrow or stem cells. Radiation and chemotherapy treatments, radiation planning, self-administered chemotherapy, special treatments, things like stem cell or hormone therapy or anything that's like considered a special treatment. You know, the best way to beat cancer is to catch it early, and so we actually will pay what we call a wellness benefit that pays for you to get your normal cancer screenings. So that's, and then the transportation that we talked about, where you're treated for cancer can play a huge role in the survival rate. And so that's why we pay money directly to the family so that they can travel. We also pay for a lodging benefit. So when they're there, they can have a place to stay, and we'll pay $200 a night for that. So that's basically a summary of what it covers. So, but one other thing besides cancer is our intensive care plan. That's this next slide. Obviously, you'll agree that there's more than one way that you could end up having to stay in the hospital, and one of them is our intensive care. So no matter what the reason is, so for any reason at all, if someone has to stay in intensive care, we pay money directly to them. In fact, it's $1,600 per day for the adults. If it's one of our children, it's only $600, or I'm sorry, half of that, $800 per day. Now, if it's a vehicular accident that puts you in the intensive care, that doubles. So it's an additional $1,600 or $3,200 per day for the adults, and then $1,600 per day for the children. After you get out of intensive care, many times you'll stay in like a step-down unit or like an acute care. Well, this policy starts paying when you make that transfer as well of $1,200 per day. And if you were to need an ambulance, we pay for a ground or a surface ambulance and also for life flight. And then if you do pass away because of the accident, there's a accidental death benefit in this policy. So that's the cancer and the intensive care. As you probably remember, it sort of makes sense to have these policies even if you never use it, because it's a built-in return of premium. So whether you, if you never use it, then you get 100% of your money back, which is great. It's just like a little savings account. It's okay to make a claim though. Let's say that we paid you a small amount. Let's say you gave us $25,000 and we ended up paying you $5,000. Then your return of premium will be the difference of $20,000. And then if you really needed it, then then you got to use the insurance when you needed it the most. But there just won't be a return of premium. Now, heart attacks and strokes are very serious as well. This next slide is our heart attack and stroke plan, and I'll read to you some of the things on this brochure. Heart attacks, heart disease, and strokes are the cause of 1 of every 3 deaths in the United States. You know, with cancer, it's bad. Cancer's bad, but cancer is one of those things, in my opinion, that it kind of reminds me of like a hurricane. Really, really bad, but usually we'll feel something like a bump or a lump. Not always, but usually something doesn't feel right, so you go to the doctor and get it checked out, and then find out possibly that you might have cancer. But heart attack, on the other hand, is more like an earthquake. It's just boom, it just happens. And so they've come up with, Family Heritage has come up with risk factors, health risk factors for heart problems. And one of them it's hereditary. With cancer, we talked earlier, 3 out of 4 of the cancer cases are not hereditary. It actually comes from the environment. Well, it's just the opposite with heart problems. In fact, I think it's closer to 90% of heart issues or stroke issues are blamed on hereditary reasons. So that's number one. Obviously, increasing age is a risk factor, high cholesterol, tobacco, high blood pressure, physical inactivity, stress, diet, and diabetes. Those are the 9 risk factors for having some sort of a problem with cardiovascular, heart attack or stroke. Now this is going to look very similar because it's really works the exact same way. Your health insurance is going to pay the doctors and the hospitals, and we're going to pay money directly to the family to take care of their lost income, living expenses, same stuff. This looks very similar too, right? There's 4 different columns with the amounts it pays for the 4 different levels of coverage that we have. First thing that happens is as soon as there's a heart attack or a stroke, we have a first occurrence benefit that pays the exact same, $6,000. Once treatment begins, there's a hospital benefit that's exactly the same. Ambulance, surgery. Instead of chemotherapy, this one has physical therapy. But there's a wellness benefit. We call it the heart healthy benefit. And where you're treated for heart problems also has a huge increase in survival rate depending on where you are treated. And so we have the same travel benefit here. $2,500 for a round trip airfare. If you take a car, train, bus, something like that, then they pay 60 cents per mile. Send the patient and a family member and then put them in a hotel while they're there for $200 per night. The heart plan also has a heart transplant benefit that pays $160,000 to them if they need a new heart. Again, the return of premium is exactly the same. So these policies look very similar. It's just one's for cancer and one's for heart attack and stroke. Now, the injury plan is our 4th policy. So I've done the cancer, intensive care, the heart plan, and now we're on the injury plan. I'll just read this to you. Accidental injuries and death can occur in the home, on the job, and to your children. The risk factors are obvious, right? Work, home, school, travel, slip and falls, poison, drowning, fire, burn, and sports. Those are sort of the leading indicators of the risk factors for having an accident. Now this plan is designed exactly the same way. All the money is paid directly to the family. It's designed to pay in addition to anything else that they already have in place, and it covers everybody in the family. So I won't go through every one of these benefits, but basically it's anything that happens by accident, right? So if you burn yourself, if you step on a nail, if you fall down and break your leg, if you are in a car accident, whatever you can imagine. So let's just assume that an accident happened and you go to the emergency room. We're going to begin paying you as soon as you go, $400 benefit for just going to the emergency room. It's designed to cover things like tetanus shots, typical like a chipped tooth or any type of an emergency procedure. Now, if you need a special diagnostic scan, things like MRIs or CT scans or stuff like that, then it's going to pay an additional $400 for that. If you have to stay in the hospital, it's just like our other plans. It pays $800 per day. Actually, the first day they're going to give you $4,000, but then every other day it's $800 because there's a hospital benefit plus plan that pays an additional $3,200 for the first day, and then $800 per day up to 6 months in the hospital for the injury. Many times you don't get admitted into the hospital for accidents anymore. You go to an observatory room, so we have a benefit that'll pay $400 for that. If you need an ambulance, it's $1,200 for surface ambulance and $2,400 for life flight. You don't have to break a bone for this to kick in. It could just be a fracture. But if you were to fracture a bone, any bone in your body, it covers every single bone from your head down to your toes. And so we have a fracture benefit that if it were a big bone, let's say you broke your thigh, then it's going to pay you $10,000. If you were to break like a wrist or an ankle, then it pays $2,000 or $2,500, something like that. Now, if you dislocate something, it'll pay $6,000 for like a shoulder. For a hip, and then $2,500 if it were a shoulder or something like that. If you need surgery, it pays for that. Physical therapy, again, if you have a surgery on your shoulder or knee, you're going to need to rehab it, and so we'll pay for the physical therapy. If you have a concussion, it pays money, and if you're in a coma, it pays money. If you ended up losing like your hand, foot, eye, or sight, then it'll pay $20,000 per, up to two. Or if you have more than one, it'll pay $40,000. Accidental death is $40,000 here if you were to pass away because of the accident. And then this has a family lodging benefit too. You might be let's say you're on a ski trip somewhere with your family and somebody hurts themselves and you have to extend the trip. Then they'll give you money for the lodging. And then if one of the adults were to pass away, then the Family Heritage will give money to all of the children that are on the plan for an education benefit of up to $24,000 per child. It's really a great plan as well. I call this the everyday plan. With my 4 children, it seems like we're using this policy every day. So, but it works exactly the same way. If we don't use it, we just get all of our money back. And so that is the products in a nutshell. I'm looking forward to answering any questions that you might have in the event that we set up a one-on-one in-person interview. Thank you for attending the product knowledge portion of the interview process. Have a great day.